Okay, folks, let's look at the new CDC listed program with the new medicines for AIDS virus that are designed to reduce infection rates at a 90% reduction rate. Okay, that's 1 in 10. Okay, the average person, according to a study that went all the way back to Penthouse magazine back in the late 70s, early 80s, estimated the average person had sex 3 times a week. So if we figure a 1 in 10 infection rate, or 90% rate, that's 3 to 4 weeks to get infected if you're having sex with somebody who's infected. But now, let's look at this from another viewpoint. Let's say you're a sex worker, you have the AIDS virus, and you're taking this drug, and so is the guys you're having sex with, they're taking a drug. Okay, let's figure these 10 guys go out with you every Saturday. Okay, that means the first Saturday one gets it. Second Saturday there's a chance that one of the others will get it. Takes about 6 months technically for about all 10 of them to catch it from her. Let's say all 10 are married and are taking the medicine even when they're having it with their wives. Well, again, that means the chances of them giving it to their wives is lower. Instead of all the wives having a good chance of catching it within 2 to 3 months, which is actually a generous amount of time to give them, you're talking about the last one might be 3 or 4 years before they catch it, if they even catch it from the person, before they die. I mean, their husband may die before they even catch the disease from him. So there's some definite advantages to it, taking this medicine, if you're a homosexual or if you're bisexual, or whatever the case may be. It should lower initial infection rates, but the biggest problem is initial infection rates do not consider what I call the reinfection rate, which is the possibility that had you not already had the disease, you would have caught it anyway. Let's say you did something today that you would have caught the disease from, but you were taking this medicine instead. But let's say you caught the disease today, and say you did something 2 weeks from now that you would have caught the disease again if it was possible to catch the disease again. When you look at influenza, this is very rare. Happens, but very rare that you catch it twice in the same season. And it's almost non-existent now we have vaccines, but it does occasionally happen, that 1 in 100,000, 1 in a million chance that you can catch it twice in the same season. But as rare as reinfection rates are, they are possible. And when figuring potential reinfection rates in there, then I figure that all the people involved still have a good 1-year probability of catching the AIDS virus. From a situation where we're talking all of them would have had it in 2 months, maybe 3, to where almost all of them would have had it in a year, with possibility of giving it to even more people, versus the 2 to 3 months, and then if the wives themselves were unfaithful, they could have given it to other people. Plus, by taking this medication, you may also reduce the chances of transmission to your unborn child. There's a specific medicine that's like 20% effective for that, but this may actually help as well. So that's my rundown of this one. I hope this helps everybody. Have a good day. Thomas Willis out.